Hi sweet friends, my name is Jeannie. Welcome to my channel. Today's video is a lot different than what I usually post, but I wanted to give you this information to help you be more aware and just to give you knowledge of what I went through. So therefore it may help you or a family member. So let me go to my backstory. So at 38 years old, I had my first mammogram, and it revealed that I had several different clusters of microcalcifications, which are like little sand spurs almost. There's just little clusters, and when they're in clusters, they tend to think it's more apt to be cancer because that's some of the characteristics of cancer. So they put me down for a biopsy. They did a mammogram and took a wire. They do it a lot more sophisticated now, but they took a wire, and with the mammogram view, they placed the wire where several of the clusters were, and then put me to sleep and cut those wires out. And the tissue around that they tested. Well, it revealed that I had atypical hyperplasia. This was when I was 38 years old, which gives you a higher risk. It's like irregular cells, and it gives you like a higher risk of developing breast cancer. So they put me on tamoxifen, which is an oral drug. It's like a hormone blocker, estrogen blocker. They put me on that, wanted to put me on that for 5 years, and I took it for 18 months and got a blood clot from here to here in my right arm. And they said, okay, no more tamoxifen. I was getting MRIs at 6 months and mammograms at 6 months for several years. And at 18 months, after beginning the tamoxifen, I got that blood clot. They said, no more tamoxifen for you. You can't take it again. You could have a clot in your lung and die immediately. So I kind of felt like a sitting duck a little bit. So I was continuing the MRIs and mammograms, but I went and saw a high-risk specialist because having those kind of cells can make you at a higher risk of developing breast cancer. And the tamoxifen I took would put you down to what a regular person's risk would be. So after I couldn't take it anymore, they said, well, you're doing everything you can do. Just keep exercising and keep doing your MRIs and mammograms, and that's all you can do. Okay, so fast forward a couple of years. When I was 45 years old, I had my normal regular mammogram, and everything was perfect. It was great. They told me several years earlier that, if you don't feel like it, you don't have to continue to do these MRIs. I know they're costly because it was like a $600 deductible, and they're costly, and it takes a long time, and they have to stick you with a needle, and I mean, it was just costly, most of the thing, and it made me worry. I mean, you always kind of hold your breath till you get that result back. So when I really wasn't worried any other day, So let me let my puppy in. She's whining. Okay, so anyways, I quit doing those for several years, like 2 years ahead of time, because they said I didn't really need them. Well, when I had that normal mammogram when I was 45, I was like, yes, great, another year, doing great. So I was so glad about that. And about 7.5 weeks later, my husband found a lump just to the inner part of my breast near the cleavage. If I had any, I didn't ever have any. So my husband found a lump, and this was late on a Friday evening on his birthday, actually his 50th birthday. He found it. And so I had already been seeing the oncologist. I'm an oncology nurse, and I've worked for the same oncologist for over 20 years. And I went and knocked on his door on Monday morning, and I said, I don't think it's anything, I didn't say that. I said, I just want to let you know I have a new area I'm concerned with. I said, do you mind checking it out? And him and the nurse practitioner came in there and did an exam and said, we don't think it's anything, but with your history, let's go ahead and do an ultrasound. So that was on Monday. On Thursday after work, I went straight to the mammogram and ultrasound center, and the same doctor that diagnosed me with that suggested the first biopsy when I was 38, I told her to be honest with me. I said, Dr. Yancey, I said, do you think it's cancer? And she said, Jeannie, I really do think it is. She said, if you put a gun to my head right now and said, tell me yes or no, I would say yes. And I was like, oh, okay. All right. Well, thanks for letting me know. Well, apparently I'm glad I didn't have my phone on, because my regular oncologist called me at home that night because Dr. Yancey had called him and said, this is really looking like cancer. I just wanted to give you a heads up. I know she's your nurse, blah, blah, blah. So I'm glad I didn't get that phone call till the next day, because I was like, look, if the doctor says that he left a message, we're going to take really good care of you. Don't you worry about a thing. Everything's going to be all right. And I was like, oh crap. Now I know I have cancer. It freaked me out a little bit. So, the next week I went for a biopsy. My surgeon said, we don't have to put you to sleep. It's up to you, whatever kind of biopsy you want. You can be put to sleep, or we can just do an ultrasound guided. And I'm like, let me ask my oncologist and see what he recommends. And he said, whatever. You don't have to be put to sleep. He said, they can determine cancer just as easy by not putting you to sleep and just doing an ultrasound guided biopsy. And I'm like, well, let's do that. So that was on the books for for Wednesday. So we went and did that. It was nothing. They just do, they did like a core biopsy. So they take you could feel it, so you didn't really have to do the ultrasound, but she did. And she did like 8 cores. It's like they stick you with a punch. It's like a punch biopsy, and it takes a tissue. It's like a little stem or something. It takes it right out of your breast. It was already numbed up. It didn't hurt. And, I could feel the pressure and stuff and the clicking, and we talked and laughed during the thing. And so, then they put a clip in there and they do another series of mammograms. So just to make sure the clip's in the right space and make sure they got tissue from the right area and everything. So fast forward, I was a mess between the biopsy and the diagnosis. I was a mess. I can just be honest. That's the only time I cried. That when, oh yeah, you have cancer, I didn't cry. It was that unknown, that period of unknown between the biopsy and finding out for sure that I did, because I didn't know what I was up against. And I read so many times in the Bible, do not fear, do not be afraid, I'm with you. And I just kept telling myself that and praying, and boy, that brought a very much closer relationship with Jesus Christ to me, which I always have had, but it got closer that week for sure. I did a lot of crying and praying, and, all by myself. It wasn't like I was putting it on anybody else, but I knew. It's almost like I knew. I just needed the confirmation. I kind of felt like I already did, because just from what they were telling me. So, I went to work on Monday morning, and I was like, I worked for the doctor, and the nurse practitioner walked by, and it was like 8:30 in the morning. I have to be there at 8. And I said, Tracy, have you heard anything about my biopsy? And her head went down, and she started getting teary right away. And I'm like, Trace, it's okay, baby. It's just me. I said, it's all right. No matter what it's going to be, I'm going to be fine. And I just knew in my heart I was going to be fine no matter what. And she said, Jeannie, I'm so sorry. She said, your biopsy was positive. She said, you have 2 different kinds of cancer. And just know we're going to take really good care of you. And I'm like, Tracy, it's okay, honey. And I hugged her, and I'm like, we're going to be okay. It's fine. But, when you work with somebody that long, you kind of get a rapport with them. And she was just great about it. So anyways, I wasn't back at my desk an hour. And I don't know if you know, but nurses don't typically sit at their desk long. And my cell phone rang, and it was Becky at the surgeon's office. And she said, Jeannie, I need to, the doctor needs to see you this afternoon to decide whether you get a mastectomy or not. And she goes, well, let me rephrase that. She said, whether you get 1 mastectomy or 2. And I said, Becky, I haven't even told my husband yet. I said, I just found out just a few minutes ago, just less than an hour ago. And she goes, I know, but it's time. We need to go ahead and put this on the books. So she made me an appointment for that afternoon. We were actually going to be there anyways to discuss my biopsy results. Well, I didn't tell my husband. I didn't want my husband being told by a stranger. Well, he had met this doctor before, but I didn't want him finding out by the doctor. I wanted to tell him. So I told him, I said, my doctor's appointment's this afternoon at 3:30. Well, I told him it was at 3 so I could meet him in the parking lot, which was connected to where I work too. It's not connected in the same building, but the same parking lot. And so I sat in his truck and told him, I said, they told me this morning that my biopsy's positive for cancer. I said, and I just wanted to tell you because I didn't, want him to have to tell you. And he said, okay. He said, we just got to figure out what we're up against. Well, they got in there and just started discussing it and said they were going to do I always told myself if I ever had to have a mastectomy, I wouldn't just do one because you still have obviously a higher risk of getting breast cancer. If you have it in one, you have a higher risk of developing it in the other. And I was already at high risk. I found out that when I was 38, and then I had cancer in the other one. Well, the day that I went for the ultrasound and repeat mammograms, she said, I guarantee you if these are cancer, I had like buckshot throughout the right breast. She said, I guarantee you if these are cancer, that this one is cancer. And she said I would do what we call a Rosenberg special. He was my surgeon and I guess plastic surgeon, reconstructive surgeon, whatever you want to call it, do a Rosenberg special. So that's taking them both off and then getting them rebuilt. Or reconstructed, however you want to call it. They use your tummy fat and bring it up, and that makes breasts. Okay, so anyways, so him and my husband start talking about one mastectomy or two, and he says, well, I don't want her to get both done at the same time. I will, he said, I'll do one. He said, then she can do the chemo, and then I'll do the other one. I said, oh, no, sir, we're not doing that. I said, I'm a runner. I am active. I'm a nurse. I never stop. I said, I'm not going to be lopsided for 6 months or a year or whatever. I said, just do them both at the same time. So then I don't have to take off twice. And it just was an absolute frustration right there. Cause he was like, no, we're not going to do this. Cause if it doesn't heal, then we'll have to delay chemo and blah, blah, blah. Him and my husband started, shut up, y'all. He said, both of y'all, can you be quiet for a second? Let me say something. And him and the doctor started talking. So I'm like, he went out for just a second. And I told my husband, I said, if he doesn't do both, I will find a surgeon that will. And he was like, okay. I said, I just feel very strongly about it. I said, and if they just want to take one off, I said, we already know I'm at high risk. I said, just get them off both and don't worry about waiting. Just do it. And, so we agreed to do that, and we had a vacation scheduled. So we went ahead and did a little week's vacation after the hurricane came through. So we got delayed by a day. We got back in time just for me to do my 1 day of work, leave early to go for my pre-op appointment on Monday. And my double mastectomy was on Tuesday, October 25th, 2016. So I went in that morning and I was okay with it. I said, I really wasn't sad or anything. And my daughter looked at me, she goes, Mom, you're just like out here, just like, she said, it's like you're just here visiting the family. You're not upset or anything. I said, baby, I'm not upset. I said, God's got this. I said, he's going to take care of me. And I know that. And I think that really impacted her a lot. But, I was there at 6:00 in the morning and I left at 9:30 at night, and everything went fine. I was a little nauseated afterwards, but he let me see. I had a male nurse after, and he let me see. And so I just had what they call a skin sparing mastectomy. So they took both breasts off and they just don't cut off the extra skin. And then they sew you up. I had them done this way, up and down, vertical, because I saw my plastic surgeon ahead of time, and that's what he recommended. And my regular surgeon wanted me to see the plastic surgeon first and wanted his opinion. So anyways, I did great with that. I had 2 drains. I had a drain coming out of each chest area and didn't have any problem. I took Tylenol, Advil, didn't really need much. I had to be off for 3 weeks. So I went back to the doctor on the 31st and I saw the surgeon. He took 1 drain out and left the other one in because it was still draining a lot. Still doing fine. And I had to go over and see my oncologist. And he said, I'm so sorry, Jeannie. He said, we got your MammaPrint results back. And what it does is it lists whether it should be, I got my biopsy results back and everything. I was ER/PR positive, so estrogen receptor positive, progesterone receptor positive, and HER2 negative. So really the best kind you can get. But my MammaPrint results resulted that I was high risk for recurrence. You either get a high or a low, and I was a high, which means they recommend chemotherapy. And the doctor said, I'm so sorry, Jeannie. He said, your MammaPrint said you're high risk for recurrence. He said, high risk for return. So he said, you're going to need to do chemotherapy. And I said, oh, okay, all right, that's fine. And I was so disappointed. And I remember my mom saying, why are you so disappointed? If God wants you to take chemo, you'll have to take chemo. And I said, I'm sorry, Mom. This is what I do for a living. I know how it makes people feel. I said, and I don't know what it does to you. You're going to lose your hair and your eyelashes and your eyebrows. And, I thought losing my boobs was enough, Mom. Sorry. It felt kind of, I don't know. I was not thrilled about it, but of course you have to do what you have to do. So on November 17th, I started my first chemo. I went back to work on November 16th, worked a full day, and then I took the 17th. I only took the days of my chemotherapy off because I'd just taken 3 weeks off with my mastectomy. So I just didn't figure that my brain would work that well to, be thinking about giving people chemo and iron. And that's what I do all day. I start IVs, access ports. Anyways, the girls were my coworkers, not just girls and guys were wonderful. They, my appointment to see the doctor and start chemo was that afternoon, and they were wonderful. They presented me with a bag that had like ginger chews in it and little puzzles and pens and chemo socks, the fuzzy chemo socks and, peppermints and, just little breast cancer things and a handmade quilt, and they were just wonderful. They were so sweet, and everybody surrounded me. We took a picture. My daughter went with me, and my husband went with me for my first treatment, and everything went great. It was fabulous. I didn't have any problem. Actually, the next morning I got up and I did have to do the Neulasta. It's a growth factor that helps to keep your white blood cell count from going so low, so you don't get neutropenic, which is a low white count, and get infection. So that's what used to kill people in the olden days when they took chemo. Is the chemo knocks out all your blood cells, all your white blood cells, and you get infection, and then you can't fight it, and then you die. So this in strong chemotherapy, they typically give you this Neulasta. So I wore this little like a cartridge, like about this big, a cartridge about that big on my side for 27 hours after I finished my chemo. And then at the end of 27 hours, over 45 minutes, it like gives you this medication slowly. Or you could just take a shot, but our clinic used the one that gives itself. So I worked the day after chemo. Well, day 13, the day after my chemo, actually ran a 5K because I had already had it. It was Silver Springs State Park. I had already signed up for it, and I decided I was going to go ahead and do it. And I had Pink Hills had visited me a few days before, and so they gave me a beanie, and it was really cold that morning, surprisingly, that morning when we woke up. So I had my hot pink beanie on and all my black, and I went ahead and did it. And I think I just walked fast. I don't think I ran it because it was real sandy. So anyways, I was glad of that. So everything went fine with my chemo. I lost my hair completely day 13. I was coming to work, and my coworker, he took a big I mean, it was just coming out just by itself. And he took a big wad of it. And I was going that afternoon to get my head shaved because it was day 13, like I say, and it was just coming out by the handfuls. And I washed it that morning and then tried to style it. And not only did it look like there was a dead kitty cat in the shower with me, but then I tried to style it and blow dry it and straighten it. And it was just a mess. I was missing so much hair at that point. Anyways, my coworker took a big thing and he did the mustache like this, and he's like the Fu Manchu, whatever. He was having fun and being goofy and making us laugh. So anyways, I went and got my head shaved. My daughter went with me, and my hairdresser did it for free. She was so wonderful. And I got home, and my husband kind of had tears in his eyes. He said, "You look beautiful." And I said, "Thank you." He said, "You doing okay?" I said, "I am." Actually, your head gets very sore when it's trying to pull the hair, when it's trying to let go of the hair. And once it was shaved, it almost was like the length didn't make it hurt anymore. But, I'm a Jeep girl, and I was driving and the windows would be down, especially, afterwards, because it's fall and that's the perfect time. And I could see some hairs flying back out. And it took forever for me to get all those hairs out of the Jeep. It was, just they stick to carpet and it just was a mess. So anyways, I did start having some stomach issues around cycle 3, and they thought I had gastroparesis, where your digestion, your colon starts slowing down, your intestines start slowing down, and so kind of food backs up. You can't go to the bathroom, and you can't really get much inside either because it's just you feel full. So I had to have some tests. They delayed my 4th treatment. I finished chemo like the last day of January in 2017. And I ended up getting an iron infusion the following week because I'd never been anemic in my life, but the chemo kind of made me anemic. But I did really great, and the patients absolutely love seeing me bald. So the first day I came to work with no hair, the first day I had just a little cover thing. I didn't have my wig yet, but I don't know if you've ever worn a wig, but when you have no hair, it sticks like pins. And even with the thing under it, it felt uncomfortable. It felt hot. Chemo put me into hot flashes. I had started having hot flashes all the time. So I would be fine one second, the next minute I would be like all red and sweaty and gross, and the hat had to go, or the wig had to go. So I just wore this little thing, and I told one of my coworkers, I said, I'm so embarrassed. I said, I don't want to take it off. I said, but I'm having a hot flash. And he said to me, "Jeannie, you do know where you work, right?" And I said, "Yeah, but I don't want to make anybody feel uncomfortable." He said, "Again, you do know where you work, right? We're used to dealing with people with no hair, and they're used to being no hair. You're not going to offend anybody." And I actually think the patients would like it. Well, they absolutely, I had to really, really make them say, "You know what? It's not all about me, guys. How are you doing?" Because they would be so worried about me. I'm like, "No, I'm good. I'm really good." Because I had no breasts for, I don't know, October to mid-May, something like that. And so I couldn't wear anything. I could wear those little shelf bras, the little tank top with a liner, but I couldn't wear anything else. It took me forever, not for the breast that had the cancer in it to heal. For the breast that had the cancer in it to heal. I probably started chemo a little bit too early because my incision, it wasn't closed. And it kept having like a little pocket that was open. It just wouldn't seal up. No infection or anything. It just wouldn't seal up. And we kept packing it or putting like a menstruation pad or whatever on it. But it just took forever to heal. Anyways, so I had no boobs and no hair, and it was quite obvious. In a uniform, you're flat as a fritter. And all my patients pretty much knew me, because I had been there forever. And you can't really hide no hair, even if you have a little head wrap on. You can't really hide no hair, because I didn't lose my eyebrows at first, but my eyelashes, the next morning after having my head shaved, I rubbed my eye like this, and a handful of eyelashes came out. And I looked at my husband and I got a little teary-eyed with that. And he goes, so you're okay with your hair falling out, just not your eyelashes? I said, I guess so, because it just was really traumatic. I'm like, they're going too. So anyways, so I look like a deranged unicorn because I had like 2 eyelashes over here and 1 over here. So I quit wearing mascara and just wore eyeliner so it didn't look like I was dead. I'd still wear my whole makeup, just no mascara, because it just accentuated that I had no eyelashes. So anyways, fast forward, doing great, healing, hair's growing a little bit back. My practice manager, she keeps pushing me. She goes, go ahead and get on the books for your reconstruction. And I'm like, I cannot take off 8 weeks without pay. I said, my FMLA is all used up. I said, and I don't have the money to be out of work for 8 weeks. She said, just go ahead and get it on the books. And I'm like, okay. I'm thinking I'm still not going to get it done. I'm going to have to cancel it. But anyways, we scheduled it for the day after Mother's Day, 2017. And so get in there, and it is a very long surgery, like 9-hour surgery. So they take your stomach fat, they cut you from hip to hip, and the little mommy pouch that we all have or had, whatever, is they take that off and they put it onto your chest in 2 sections. And they take an artery from your abdomen and weed it all up underneath your, inside your body. They weed it all up into the artery, and they put it up here, and that gives blood flow. So it gives blood flow, oxygen, blood, everything to your tissue, the tissue that they took from your abdomen and put on your chest. It's called a DIEP, a deep flap perforator. So it's a deep inferior epigastric flap perforator, whatever. So it takes that little bitty artery and then your belly fat and puts it up here. So it is a very major surgery, abdomen and chest. So your chest is cut here to here, like here to here, and then here to here. And then your stomach is cut all the way worse than a C-section. I mean, it's truly one side of my hip, I can't see straight in the mirror. I can't see where it ends on either side. So it goes all the way to almost to the back side of my hip. So after the surgery, they put you in ICU for 4 days, cardiac ICU. It's not because you're that sick. It's that they need to monitor the blood flow closely every 30 minutes, because if that blood flow stops, then this tissue dies and they just have to throw it away. And where else are you going to get that much fat from to make at least a B-size cup? So anyways, when I came back from surgery, my husband and daughter were not in the room yet. So I went from post-op right to the cardiac ICU. That's what it's like a step down sort of. So, no, it's not a step down, not yet. I'm sorry. You go to that and they monitor you. Anyways, I got back to the room and I was like, Lord, I know I prayed that everything would be fine and that I wanted boobies. I said, but I am in excruciating pain and I'm struggling to deal with this. Please help me. I was hurting so bad. It was overwhelming. It was almost like I knew I wasn't myself and I couldn't breathe. I couldn't take a breath right. Something was definitely wrong. And I'm like, the nurse Bonnie, I still remember her to this day. She was worth her weight in gold. She said, Jeannie, I'm not sure what's wrong. She said, let me see your IV. And I had 2 IVs in, and one wasn't hooked to anything, and the other one wasn't hooked to anything, but she tried to flush it. Both IVs were bad. So I hadn't gotten any pain medication. I don't know if this one was working at the time I had surgery. I'm sure it was, because I had to be dripping fluids and pushing stuff and whatever. Well, anyway, she said, Jeannie, give me just a minute. I will have you in less than 3 minutes. I know I'm trying to calm myself down and trying to breathe and doing what I'm supposed to do. But I felt like I was on the cliff about to dive off. I was really in pain. And she had an IV in me and gave me pain medication. I was a new woman within 3 minutes. It was just amazing. And I did not have, I mean, I had soreness afterwards, but I never had any of that just absolutely overwhelming pain. I never had it again, thank goodness. So day 2, they get you up the day after the surgery, and the 2 nurses now, not medical assistants, not aides, the 2 nurses they walk you to the bathroom, and they stand in the shower, stand outside the shower while you bathe, and they keep peeking around. Are you okay? Do you need anything? Are you dizzy? Blah, blah, blah. Because if you fall, that's why they don't want you to drive for 8 weeks, is they don't want you to damage that area, because if something pulls, it could be. I forgot to tell you something else. Of course, I got to go back and tell you that. So when I finally did get my surgery on the books, the practice manager said to me, she said, now that you have it on the books, she said, I want to let you know that all your coworkers have gotten together. And this still is just absolutely humbling every time I think about it. They have all gotten together and donated enough PTO, paid time off, that you won't miss a single day of work if you take 8 weeks off for your surgery. And if you need more, she said that we have had offers for you to, people have offered it up. If you need more, they'll be glad to give it to you. And I'm talking about every time somebody talked about this for a year, I think I cried, because I was just so humbled by the whole thing, because I had no idea. And I just knew that I wasn't going to put my family at risk being off of work when I just wanted boobies. I mean, I was 45 years old. I didn't want to be without boobies the rest of my life. And I know some people choose that. That's great. I just didn't want to be. And I miss those more than I did my hair. I know that sounds weird, but I did. And so that's why I went ahead and had the surgery in May like I had scheduled. So anyways, the next day after my shower and stuff, get back to the bed, I'm fine. A couple hours in bed, I'm like, you know what? I said, is it okay to walk around? She goes, we actually want you to walk around. So got up. Now, I still had there's a little pain thing that's attached into your belly like a balloon, and it deflates slowly. But other than that, I wasn't taking like IV pain medicine or anything. So hubby and I remember at 2:00 in the morning one morning, I had him, he stayed with me, I think 2 or 3 nights. And, just in a little cot beside the bed, or like a recliner. And I got him up because they didn't want you walking by yourself, like at 2:00 in the morning. Not to mention, they come in every 30 minutes. And some of the nurses were good enough, they didn't have to flash on the light because they knew right where it was. And some of them did. But I had they gave you the little eye mask, like sleep mask. But, I was fine. It didn't bother me. I'd go right back to sleep. But got up and walked around the whole, as long as they don't have to buzz you in, you can walk as far as you want, as long as they don't have to buzz you back into the ICU. So, so that was on Tuesday, Wednesday, Thursday, and Friday afternoon, I think I went home and, live an hour away from the hospital, and got home, had 4 drains in, 2 in my abdomen and 2 where the breasts were now. And, that was a whole lot different story than the mastectomy. I had to take pain medication regularly, but I didn't take a lot. I did have to take some nausea medicine. I'm really weird with pain medication. I don't do well with that. I usually itch and try to throw up. So I had to have anti-nausea and anti-itch medicine before I had every pain medication. So at my 1-week follow-up, I go in and so much of the swelling has gone down. And I hope none of these pictures bother y'all, but it shows you kind of what I went through. I'll bleep out anything that needs to be bleeped out, but these are not like real boobs or anything, okay? They're my tummy fat. So I guess they are real boobs now because, here I am. But it just, I was like a new person already. I was like, I'd lost so much water weight because you're so swollen after the whole surgery and stuff. And they told me that day, said, you need to go ahead and start getting off the pain medication. I said, already? And she said, yeah, within the next week, I want you to be completely off. And I'm like, okay. And it kind of was funny because I started doing a little stuff, but then I'd overdo it and I'd be like teary by 4:00 in the afternoon. I'm like, okay, you need to slow down. And I'd take pain medicine and lay down. I'm like, well, stop doing that stuff. You're not supposed to be doing it because, you're not supposed to reach over your head and, because you got you get those little cording things, and oh, it was just a mess. But anyways, I laid low. I couldn't drive for 8 weeks, so my daughter drove. I had a brand new Jeep that I got the day before my mastectomy. I got to drive it one day and before my mastectomy, and so drove it during my chemo and stuff, but I couldn't drive it for 8 weeks after my reconstruction. I had to have a little stool to step up into it because you're not supposed to be reaching and pulling. And anyways, it all went very well. I ended up having 5 revisions eventually. And, where they do a little tweaking here, they kind of take a boob off and move it around a little bit and, add fat from your hind end or wherever, like suck it out and push it in here. And I had some fat dying, and I still do. I have a little piece here that kind of indents here, but you know what? I look like, without my clothes on, I look like, Edward Scissorhands' wife a little bit. So, scars, just tell everybody that you lived through what tried to kill you. So, the best thing I did after all my surgeries were done, was go and get tattoos done. So there's a lady that does, she's in Homestead, and I'll be glad to give you her name or number, but she works for the University of Miami part of the time, and then she has her shop that she does mostly for breast cancer survivors, does nipple reconstruction or matches your other nipple. No, I didn't have anything. I had like Barbie boobs because I just had boobs, but no point. They were pointless, completely pointless. Get it? So she does the 3D nipple restoration, and it is so cool and is awesome because it gives you something to look at other than just the scars, which was amazing to me. I feel like a woman again. And, other than gaining 60 pounds, going through chemo, which absolutely killed me because I was probably in the best shape of my life. I was training for a half marathon when I was diagnosed, and I did a half marathon. No, I did the 5K. It was 2.5 weeks after chemo. I had just lost my hair, and yes, because I'd lost my hair day 13, and 5.5 weeks after my double mastectomy, I did a little jogging and some walking, but it was a kind of like a breast cancer marathon. It was a Diva. There was a marathon and a 5K, and Diva marathon, half marathon, and a 5K. And I wrote him a letter as soon as I found out and say, listen, I actually had already paid for the half marathon. Is it okay if I just switch to the 5K? I said, I've just recently been diagnosed with breast cancer, and I think the half marathon's going to be a little much for me. And they're like, no problem. Well, last minute, my husband decides to do it with me. And there's probably 10 men in the whole race. So he walks along with me, and I inspired so many people that day because I have my little crown on my bald head, and they make a big deal and take a picture of you at the finish line with a shirtless fireman. And my husband's like, this sucks. So anyways, it was really nice. And I had so many people come up to me afterwards and say what an inspiration I was, and, said a little prayer for me or whatever. So I tried to make the best of it. I know it was just a season, and I'm so glad that we caught it early because I was stage 1. And if you're stage 4, you have a lot less chance of it staying gone because it doesn't go away. Usually they just treat it until you have it come back. You know what I'm saying? Once it's stage 4, it doesn't usually change stages backwards. You see what I'm saying? If you've already had breast cancer and it goes to your brain, when it's gone out of your brain, it's not now stage 1. You see what I'm saying? It doesn't work that way. So I was found at stage 1, and I did everything I could to help prevent it from coming back. And I still try to do that. I still, do everything I can to try to keep it from coming back. I did end up having to take a pill for 5 years, and I tried all of them, the aromatase inhibitors, the hormone blockers or whatever. I tried taking those, and they did awful things to me, either severe joint pain or terrible diarrhea, or they weren't keeping my hormones where they needed to be. So I ended up going back onto tamoxifen, the one that had given me the blood clot. I ended up being back on that for equivalent of 5 years. So, and then I had the test that said I only needed to do 5 years. So I am completely done. I see my oncologist next week on the 28th, just for my checkup and my yearly checkup, and not having any signs of it ever it coming back or anything. And the bad thing about with stage 1, and they took it away when they did the mastectomy. So I'm officially, tomorrow will be 9 years that I am cancer free. But with my kind of cancer, they don't test you for anything. There's no blood test. There's no, okay, we're going to look at your boobs, because there's no breast tissue there. So they actually wait and see if you have symptoms. And if you have symptoms like headaches or dizziness, it could be in your brain. They do an MRI of your brain. Or if you're having pain in your abdomen and, start to turn yellow or something, it could possibly be in your liver. They'll do a PET scan to see if it's in your liver. And yeah, it's a scary thing. And a lot of the people that I've taken care of that were stage 1, when I was stage 1, they're not here anymore. And it's really scary. And, there's all different kinds, and all different kinds of hormones that, there's estrogen driven, progesterone driven, triple negative, triple positive, whatever. There's so many different kinds, but I'm so grateful. And by sharing my story, I want you guys to be aware, because if something's not right, you need to have somebody that listens to you if something's not right. So, you can have a mammogram, but then go home that night in the shower and feel a little lump. And you're like, well, shoot, I just had my mammogram. I'm sure it's fine. I'll wait till next year. Don't. You go to your doctor, you call your doctor. And if they don't want to do anything about it, say, oh, you're too young. Because I was too young at 38, but they did one anyways, because there was something I felt or whatever. You're not too young. There's people in their 20s that we treat all the time. But even younger have been diagnosed with breast cancer. So anyways, I just want to share my story, because I want you guys to be aware that you can make your life. It sucks when you have breast cancer. Cancer sucks. It's not all bad. I got to experience some things I would never experience normally. I got to march on Capitol Hill for patient rights, which was amazing. And we got to fly to DC, and my husband got to travel the city and see all the sights, and I got to go work. But no, we had a good time. But I got to the Pink Hills truck, and I got to inspire so many people, and I still do in my day-to-day life, because I'm a nurse. I'm an oncology nurse. And when somebody's too scared to take a breath, and they're just like, I can't do this, or I don't feel strong, I can't do this, or I'm so discouraged because I'm sick all the time, or I'm do this or that or whatever, I'm saying, I touch their hand and I say, you know what? I've been there, and you can do this, and this is what we need to change, but you can do this. You have what it takes inside you. And sometimes I get to witness to people, but I can't do that without them. I have to say, I don't know how you feel about it. And then they'll tell me yes or no or whatever. And sometimes I get to witness to people. So I have to be very careful with that in the nursing profession anymore, because you don't want to offend somebody. But, you know how I feel about that. But you still have to be careful to keep your job. But it's, if I can help somebody by me going what I went through, if I can help somebody's time be easier, or if I can comfort them or soothe them or make them feel like they're not alone, it just makes them feel so at ease. And I have so many people that'll just come and love on me after, hug me and say, thank you so much. Because of you, I made it through. I said, no, we did it together. I said, I gave you the poison and you you took it. No, I'm just kidding. You just help them get through it the best way you can, whether it be with extra anti-nausea medication or just, mostly it's just support. You tell them what needs to be done and tell them what to watch out for and how to get their fingernails to stop turning gray or brown or black or whatever you can do to get them to feel their best and do their best and fight as hard as they can to get through this. It's just a season. And sometimes it's not just a season. If they're already stage 4 and they have to keep coming back week after week after week after week after week to do this, you just be there for them. You make it where they don't think about them having to come for cancer treatment. They're coming to see you, or they're coming to get your your genie fix, or, you know, whatever. You smile and you're their friend and they love coming to see you. That's what you do. And if I can help somebody not to have to go through this because they went through it, they caught it super early and they're still here with their grandbabies and their babies and their whatever, you know what? If I can help, or even to help somebody live through until till their granddaughter gets married or something, you know, being an oncology nurse is weird. The patients are so wonderful. Not all of them, but a lot of them are, because they know what it's like to have a touch, you know, for life not to be there. They've heard, hey, you have cancer, and sometimes cancer means you're not going to be there anymore. So they have that renewed spirit, renewed appreciation for life many, many times. So, but like I say, if I can help one person to either find it early or to encourage them to go get their mammograms or their ultrasounds or their MRIs, or just do a breast self-exam. And a lot of places have free mammograms you can get, whether it be in the month of October. You can just get online and start searching at the library, free mammograms, or mammograms for underprivileged people, or mammograms at no cost, or whatever. Sometimes they'll have the little church bus come around, you know, where they'll pick people up and take them all at once to go get mammograms and stuff. It's wonderful. So if you can do something to help take care of your health, whether it be your cholesterol, your blood pressure, your whatever, do it, because you need to be here. You need to be here. God still wants you here. So you guys take care, and I hope I inspired y'all to take good care of yourselves. And thank you for listening to my story. And I hope y'all have a wonderful, blessed day. Stay healthy and be blessed. Bye-bye.